Sawadee krap, and good afternoon once again. Monday, the 3rd of May 2021, and this is the English language summary of the daily press briefing here at the CCSA. So first of all, thank you to Dr. Apisamai or Dr. Bird for the recap of the CCSA daily meeting that we have today, as well as the situation so far. So I'll start off with the number of confirmed cases and the statistics and numbers that we have each day. For today, we have confirmed case at 2,041. It was lower than 2,000 for a couple of days. Now we're back to the early 2000s, so 2,041 cases. And out of that number, we have 1,943 that are from cases of local transmission, 97 from active case finding, and 1 case from within the state quarantine system. We have to date 1,726 new recoveries. If you compare that number to the new confirmed case, 2,041. So recoveries is a little bit behind the new confirmed cases. So doing the math, around 300 are the new active cases for today. But total active cases still under treatment, is 29,756. You see that on the green box on screen. Out of this number, there are 981 cases that are considered to be critical conditions. And out of 981, we have 278 cases on ventilators. For new fatalities, unfortunately, and we have to express our sincere condolences to the families of 31 new fatalities recorded for today. The cumulative number of fatalities is 276 now in Thailand. We hope that the number will not get higher. It is not a high number, a death rate that's high compared to other countries, but nevertheless, 1 death is sorrowful enough. So 31 new fatalities today. I'll break that down a bit. There are 18 male and 13 female in this number. Age is ranging from 31 to 83, median age at 58. 10 fatalities are from Bangkok and Nonthaburi each. 2 each from Pathum Thani, Nakhon Si Thammarat, and 1 each from Chha Cheong Sao, Ang Thong, Phetchaburi, Suphanburi, Lopburi, and Chayapum and Ranong provinces. Of this 31 new fatalities, we have 15 fatalities that were in close contact with confirmed cases, 6 fatalities in close contact with infected family members, and 3 fatalities who lived in risk areas or visited risk areas. Now about family members, I'll have a little bit more for you later on today. So in terms of the provincial distribution, we have provinces with the highest number of confirmed cases as being Bangkok. So that is 675 cases in Bangkok, as you see on screen, followed by Nonthaburi at 277, Samut Prakan 161, Chonburi 153, Surat Thani 69, and the other provinces, you have the numbers on screen right now. So just some observations from the new cases as recapped by Dr. Apisamai just now in Thai. So we have, as you know, the daily CCSA meeting. And in today's CCSA meeting, we discuss in detail regarding the cluster in Bangkok, particularly in Khlong Toey district. And we'll have some images coming up, I believe 2 images coming up to you on screen soon. A satellite image of the area in Khlong Toey district in Bangkok. So the CCSA plans to conduct active case findings in these areas in the next 8 days. The district officers will notify and transfer those infected to hospitals and to limit the number of people who will come in close contact with infected patients as much as possible. Now, I think there might be another picture that we'll have for you. We will conduct the active case finding in this district of Khlong Toey, as well as in other risk districts as well, risky districts as well. For example, it is said to be carried out in Pathumwan district after 142 confirmed cases have been found in that area. So you see the level of detail information, be it images, be it our analytics in terms of the pinpointing each particular location in the districts in Pathumwan or in Khlong Toey in Bangkok. So this is the level of detail that we have to go into. Our personnel goes into these details, and then we'll be conducting these active case findings in the days ahead. Now for Khlong Toey district in particular, the focus will be on the active case finding in the next coming days. And we are asking the cooperation of business owners, entrepreneurs, homeowners in the area to provide us with the best cooperation possible for the active case finding mission. There will be a royally sponsored mobile testing unit in Khlong Toey district, a couple of testing units, including in the area as wide as 70 rai in the district around the Khlong, Wat Sapan and Pathana Mai communities. And discussions will be carried out this afternoon in detail further to work out how to proceed with these missions in Khlong Toey in detail. And infected persons in these areas are asked to self-quarantine at home for the moment and await for assistance. Now, in Khlong Toey, I mentioned about the community that is in the area that is 70 rai wide. Now, in that area, it has already been found that 436 persons, active case findings have been tested, and 21 persons have been found to be infected. And in Wat Sapan area, 489 active case findings, wherein 29 were found to be infected. So in Wat Sapan district in particular, they had formed a checkpoint for to check those who are infected with mild symptoms, but without the 7 chronic diseases. And there will also be vaccination plans for those living in other risk areas to curb the spread. Now, active case finding in Bangkok in other areas, such as in Huay Khwang district, there are 2 cases wherein there had been found positive cases in Huay Khwang district in restaurants, which is why the takeaway and all of those takeaway order dine-in is not allowed in restaurants. So takeaway, that's why we have all of these cases in restaurants. So we have the measure that came out a few days ago. And we emphasize also, of course, about the eating in restaurants in the maximum controlled areas. So maximum controlled areas, maximum and strict controlled areas, those are areas with no dine-in. But for maximum controlled areas, dine-in is still allowed. For the area which is not allowed, we have, of course, the information, the fact that most cases are traced to these restaurants and small gatherings in the various eat-ins. In addition, GISDA, the Geoinformatics and Space Agency in Thailand, also suggested that many areas in Bangkok should be investigated further to find more cases. As previously, there is a high number of cases that have been found in crowded communities and markets. That number of area is actually up to 680 small communities and areas. In addition, I'd just like to talk about some suggestions for families. As we mentioned, as Dr. Pisamai had mentioned, the elderly are very much at risk. So households with the elderly, of course, the elderly should be separated from people who go outside every day. So basically, the younger people in the house and the older people in the house should limit their interaction. For those who have to leave their house for work, of course, if you come back and meet your parents or grandparents who are the elderly, take extra precaution. The Department of Disease Control also advises those living together to thoroughly clean all the shared spaces, sanitize all the shared spaces and rooms and utensils to prevent the spread of COVID within the household themselves. And firstly, try to conduct social distancing between family members within your house as well, especially the elders and in bedrooms, those who are bedridden as well. Secondly, as I mentioned, clean areas which family members often touch and use together, like doorknobs, remote controls, and always wear masks, especially when you are with the elderly. Now, just another piece of information regarding our borders and international affairs. Authorities will be providing more stricter control in the border areas, particularly along the Malaysia and Cambodian border because of the COVID situation in the border area there. So that's something that we look forward to, stricter control and more cooperation in the local communities in the provinces along the border areas. So just to update on provincial measures, to curb the spread of COVID, Chiang Mai has issued a ban on mass gatherings on indoor venues, such as indoor stadiums and restaurants from Saturday onwards. At the same time, the province is asking those who travel from red and dark red zones to report to the local disease control officials, as they would have to be under 14-day observation when arriving in Chiang Mai. So lastly, just some additional point from the World Health Organization, just to draw your attention to the latest infographic by the WHO, which will be coming up on screen. The importance of this infographic is that it stresses that to prevent the spread of COVID, the responsibility begins with each and every one of us. As I have to stress once and again, the policy for DMHTT is very, very important for Thailand, especially now that you see the number of infections kind of more or less stable in the thousands, in exactly around 2,000. So 2,000 plus minus each day now. And besides this, the World Health Organization has also emphasized that mental health is also important. So as much as you must remain vigilant, be sure to always stay relaxed and stay happy, de-stress, not be too stressed or agitated or worry too much, panic. No, that's not something that we would want all of you to experience, and not to stress out about it all. So hoping that the situation will be better. If we do all of our work, if we cooperate with each other, I'm sure that better days are ahead. So that's what I have for you for today. Please stay safe, please stay healthy, and enjoy the rest of the week. Thank you. สวัสดีครับ
ขอบคุณนะครับท่านณัฐภานุนพ